Verotoxigenic E.coli, or Vtec, is a bacterium germ that causes diarrhea and causes a toxin that may damage the bowel wall. The incubation period ranges from as little as 1 day to as many as 10 days. In most cases, the virus is acquired in the summer. Children under the age of 10 are more susceptible than other age groups. In 2014, 714 human cases of Vtec were detected in Ireland. The source of Vtec is contact with farm animals or their feces, and even in untreated water from private wells. It is then spread from person to person in high public areas such as creches, nursing homes, and hospitals. The foods which Vtec's most common outbreaks are linked with are usually raw foods or raw milk. To prevent them from being affected, foods that may contaminate the bacteria must be fully cooked. Adequate treatment of water supplies and pasteurizing milk will also kill the germs. The symptoms are diarrhea, vomiting, and/or a high temperature. However, these symptoms could range in severity, giving some no symptoms while others develop severe stomach cramps and experience bloody diarrhea. While symptoms average around 6 days, you should contact your doctor and provide a stool sample to be checked in a lab. Vtec is usually uncomplicated, and in the majority of cases people recover completely. To treat it, you should drink a lot of fluids. It is important to avoid antibiotics because they can increase the likelihood of HUS. Vtec infections can cause a life-threatening complication called hemolytic uremic syndrome, or HUS. HUS only occurs in about 5 to 10% of cases of Vtec, but it particularly affects children under the age of 5 and the elderly. This may happen in a week after the start of bloody diarrhea. Up to as many as 5% of people who develop HUS may die. You may need to give urine or blood samples to check if HUS is developing. The symptoms of HUS are decreased urine being produced, fatigue and irritability, bruising and swelling on the hands and feet. HUS is a medical emergency and must be dealt with in a hospital. Infected people and anyone in contact with them may pose a risk of infection and must be excluded from work, school and childcare until they are clear of the virus. If you are taking care of someone suffering from Vtec, wear rubber gloves when cleaning up after them and wash the gloves with soap after. It is important to wash down anything that comes into contact with either vomiting or diarrhea to stop the virus from spreading.